icon that says Q&A, and you can submit questions that way. I have a bunch of questions that were submitted in advance, but we'll try to get to as many as we can. So don't hesitate to throw those in there as soon as you can. So I'm going to introduce each speaker before they speak, and they will each give a brief presentation, and then we'll get straight into questions. So our first speaker is Dr. Ashish K. Jha. Dr. Jha is recognized globally as an expert on pandemic preparedness and response, as well as on health policy research and practice. He has led groundbreaking research around Ebola and is now on the front lines of the COVID-19 response, leading national and international analysis of key issues and advising state and federal policymakers. Dr. Jha has published more than 200 original research publications in prestigious journals such as New England Journal of Medicine, JAMA, and BMJ, and is a frequent contributor to a range of public media. He has extensively researched how to improve the quality and reduce the cost of healthcare, focusing on the impact of public health policy nationally and around the globe. Dr. Jha is currently the Dean of the School of Public Health at Brown University. Before that, he was a faculty member at the Harvard T.H. Chan School of Public Health and Harvard Medical School since 2005. He was the director of the Harvard Global Health Institute and also served as a Dean for Global Strategy at the Chan School. Dr. Jha, could you please provide us an overview of the vaccines available to children today, their effectiveness and risks, and the rules about parental consent?
Absolutely. I'm unmuted. Good. Hi, good evening, everybody. My name is Ashish Jha. Thank you again for having me here. And Felix, thank you for that introduction. So I'll be pretty brief, quick lay of the land of where we are as a country. Infection numbers across the country are way, way down. They are certainly way down here in Massachusetts, partly because we're doing so well on vaccinations. In Massachusetts, more than 80% of adults have gotten at least one shot. More than 70% of everybody eligible over 12 has gotten a shot. And more than 60% of our entire population is fully vaccinated. This is what's really keeping our infection numbers low. Now, if you think about children and what we know about them and where we are on them, right now we have one vaccine that is authorized for children 12 to 17, and that's the Pfizer vaccine. I expect in the upcoming weeks, we're gonna have a second vaccine authorized for kids, and that'll be the Moderna vaccine, which has been submitted to the FDA for authorization. Those will probably be our two main ones until we get to the fall. In the fall, I also expect J&J to become authorized for older kids. And in the fall, at some point, I expect younger kids, 5 through 11, to become eligible. And the reason they're not eligible right now is because the clinical trials are still ongoing, and we're studying how well these vaccines work in those kids and how safe they are and what the right dosing is. But to kind of finish up on this and on children, 3 final points. One is the data so far from Pfizer and Moderna suggests that these vaccines are exceedingly safe. I want to talk a little bit about side effects in a second, but they are very, very safe. And just as importantly, they're incredibly effective. Now, the studies so far show that they're 100% effective. I don't think anything in life is 100%, so they'll probably end up being a little less than 100%, but they look like they're quite safe and quite effective in kids. Second, it's really important that kids get vaccinated, and I'll make the argument why. Now, it's true, people love talking about how kids are less likely to get sick than older people. By the way, that's true for everything. In everything, thankfully, kids tend to be more resilient, but it doesn't mean that we don't want to protect children, and we do want to protect them. And these vaccines are very helpful. This virus will eventually become endemic in our country, meaning we're not going to eradicate it, it'll be around forever. And so if kids are not immune, they will end up getting infected at some point down the road. So I think it's very, very important that all kids get immunized. And then finally, the last point I want to make is about some of the side effect issues you've been hearing about. And primarily in children, the issue that has come up is inflammation of the heart muscle, also known as myocarditis, as well as inflammation of the lining of the heart, known as pericarditis. And both of these are quite rare. About 90% of them require no treatment at all. And the 10 to 20% that do require some treatment, kids have thankfully recovered from them. And if you compare the myocarditis risk to the risk of having bad complications if you get COVID, it's not close. In my mind, the evidence so far suggests that kids do much better with vaccinations than they do with COVID itself, and therefore it's really important that kids get vaccinated. Let me go ahead and stop there and turn it over, Felice, to our next speaker.
Thanks, Dr. Shah. That was a great overview. So Dr. Julia Kohler received her MD from her hometown university, the University of Heidelberg, Germany. She trained in pediatrics and pediatric infectious diseases at Children's Hospital in Boston. As assistant professor of pediatrics at Harvard Medical School and staff in Boston Children's Hospital Infectious Disease Division, she cares for children with complex infections and is a molecular pathogenesis bench scientist. Becoming aware of the situation of her immigrant patient families, she co-founded the Immigrant Health Special Interest Group of the American Academy of Pediatrics and chairs the Immigrant Health Committee of the Academy's Massachusetts chapter. Having partnered with La Collaborativa in Chelsea 6 years ago to establish a mental health program for recently arrived Central American youth, she joined forces with La Collaborativa again during the pandemic to provide information to the Chelsea community about how to protect ourselves, our families, and communities from COVID-19. She organized a team of medical professionals who door knocked with La Collaborativa for 3 months this spring, offering COVID vaccine conversations together with La Collaborativa's wraparound services to Chelsea residents. So Dr. Kohler, please tell us about COVID in children. What have you seen at Children's Hospital? What are the risks of not getting vaccinated?
Thank you so much, Felice. It's a great pleasure, honor, and privilege to be here with you and with all the illustrious panelists. Last year, when the pandemic hit, we really did not know what to expect, and we were afraid that perhaps the hospital would get overwhelmed the way we saw adult hospitals filling up and filling their intensive care units. And because of the massive disease and requirements for intensive care, actually all the Boston pediatric admissions, in other words, all the children that had to be hospitalized, came to Children's Hospital. And we saw children with COVID with a astounding variety of disease, you know, from the pneumonia that we know classically that COVID causes, to inflammation of the brain called encephalitis that initially was very puzzling to us, and you know, kidney disease and heart disease especially. And I remember I was on call on a weekend last spring, it was about a year ago, a little more than a year ago, and this young boy was admitted to the intensive care unit, the cardiology unit, and his heart was failing. He was diagnosed with myocarditis, meaning an inflammation of the heart muscle, as Dr. Jha said. And we have a long panel of tests that we send for this condition, particular viruses and so on. And we had, you know, sent all of that and the blood work, etc. And then his COVID test from the PCR from the nasal swab came back positive, and the intensive care unit attending physician said, "Oh, wow, I saw a patient just like that last week." And this was our second case of MIS-C, which is an inflammatory disease that begins a few weeks after an infection with the SARS-CoV-2 virus, and it can be an infection that the child or the adolescent didn't even notice and that they were not tested for, like in this patient. And it affects the heart, it affects other organs, it affects the clotting system of our blood, etc. And it requires intensive care unit admission in many cases. Very fortunately, protocols to treat it effectively have been developed. And overall, we are very fortunate to say that at Children's Hospital, no child has died of COVID, but we have had over 2,000 children diagnosed with it. Now, they were not all admitted for COVID. They may have, had to come in for a broken bone and were also found to be positive for COVID. But this, for example, we also had over 100 children. I'm just looking at my numbers here. Yeah, over 100 children with this inflammatory condition.
Wow.
I am telling you this to say that I never accepted the myth that children are not affected by COVID. They are affected by COVID. The last influenza season, which was 2019-20, which we considered quite a severe season in the United States. 244, I think it was, children died of influenza, which is flu. It is already around 400 children who have died of COVID. We immunize all children that we can reach, where we can, we try to immunize all children against influenza because it is a dangerous virus for children. This virus, COVID, is also dangerous for children. I'll be glad to talk about these side effects that Dr. Jha mentioned later in the Q&A. I'm sure there will be parents and listeners who have questions about them, but let me just stop here and say the idea that we don't have to worry about the kids, I would very strongly disagree with that.
Thank you, Dr. Kohler. I think that's really important to keep in mind, why we're vaccinating kids and what the alternative can be for some of them. So next we'll go to Dr. Trinice Lewis Harris. And Dr. Harris is a licensed clinical psychologist and a part-time assistant professor of psychology in the Department of Psychiatry at Harvard Medical School, Cambridge Health Alliance. At CHA, she is the Director of Child Psychology Outpatient Training and the chairperson of the Department of Psychiatry's Diversity Council, in which she has spearheaded the multicultural diversity curriculum development for its multidisciplinary training programs. Dr. Harris is also the founder and CEO of Cultura Psychotherapy Consulting in Randolph, where she provides psychotherapy to adolescents, adults, and couples from all walks of life, and consults to academic, hospital, and organizational executives on the social determinants of health and multicultural issues in healthcare provision. So, Dr. Harris, you're a psychologist. What have you heard from parents about how they decide whether to vaccinate their child? How would you advise parents to think this through, and how should they talk to their children about it?
Sure. First of all, good evening to everyone. And I just want to thank the organizers for this very important panel. And I'd just like to echo the sentiments that were just expressed about the fact that COVID absolutely impacts children. In the mental health field, we talk about the mental health impact of COVID on children as really the second part of the pandemic. Many children, because of COVID, had to immediately shift their lives along with their parents to be more protective of their health. They've adjusted over this past year in many different ways to wearing masks, to going to school remotely, and then this year really working in many ways in a hybrid model. So one of the things that I hear from parents, first of all, had to do with what are the ways and circumstances where it may be safe for children to come away from home and to go into public settings. And as we speak about the vaccine, their questions really have to do with a similar vein. When will vaccines be available for children at various ages? How will we know that those vaccines are safe for children at different ages? And I know that some of those questions were addressed a little earlier. The other question that comes up is the anxiety that children feel about potentially taking off their masks now, and parents are asking questions like, how do I explain to my child what a vaccine is? How do I explain to them that a vaccine may help them be safe to return to spaces that they were used to being in without wearing a mask? And on top of that, many children, even prior to the pandemic, had great fears of needles for vaccines, regardless of that. And parents are asking questions just in general about, how do I help my child become more comfortable taking vaccines? Or will the vaccine be available to be given in various forms besides with a shot? So some of the work that I have been doing with children 12 years and up, since it's become available to children those ages, some of that work has been helping them really address the anxiety they have around needles, or even the anxiety they have about whether the vaccine will truly keep them from getting COVID. So parents are really interested in the vaccine's efficacy, and particularly in communities that have not had the most trustful relationship with the medical community, like those in Black and Brown communities. I am hearing from parents specifically, how do we know that we can not just trust that the vaccine is effective, but how do we know whether or not to trust the medical community? So I think that forums like this are really important to share facts and to share resources where parents can look at the facts on their own and helping them make decisions.
Great, thank you. Thank you. That's very helpful to parents. And we are lucky enough to have a parent with us to talk about that very decision. Vanessa Mendez is a single mother, soon to be grandmother, congratulations, and a Chilean national who has been living in Chelsea for 5 years. She works in the food pantry and as a health equity promoter at La Colaborativa, the social services organization formerly known as the Chelsea Collaborative. La Colaborativa works to empower Latinx immigrants to enhance the social and economic health of the community and its people, and to hold institutional decision makers accountable. Vanessa has 2 children, a 24-year-old daughter and a 13-year-old son. Her son was vaccinated against COVID-19 at the first youth vaccination party. Vanessa is going to speak to us in Spanish, and we don't have simultaneous translation from Spanish to English. So Vanessa, if you could take it one sentence at a time and tell us how you decided to vaccinate.
Hola, buenas tardes a todos. Muchas gracias por permitirme estar en este panel. Me siento muy afortunada de poder comentar mi experiencia como madre, de poder recibir la vacuna para mi hijo. Al principio
Vanessa,
tuve muchos miedos sobre la vacuna para él, pero fui disipando esas dudas a medida que fue pasando el tiempo, y tuve la oportunidad de hablar con la doctora Julia, que ella fue en realidad la que trató de quitarme los miedos que yo tenía al vacunar a mi hijo. Y en realidad me enfoqué también en...
Vanessa, para un momentito para que yo pueda decir lo que dijiste en inglés. ¿Está bien? Y después vuelvo a contar.
Bueno. Bueno, mis miedos eran...
espera un momentito, por favor.
Okay.
Okay. Good evening. Thank you so much for having me. It's my pleasure to be here and tell you about my experience I have a 13-year-old son, and I was worried about both about COVID, the infection that might threaten his health, and also about the vaccine. So we spoke about that at La Colaborativa with also Doctora Julia, which is myself, and we concluded to have the vaccine given. Okay, Huelva, por favor, sigue.
Bueno, entonces, después de haber hablado con la doctora Julia, que disipó mis dudas, accedí a recibir la vacuna. Mi gran miedo era sobre el sistema inmunológico de los jóvenes hoy en día, porque siento que la alimentación que ellos están recibiendo o que los padres le estamos dando a nuestros hijos no es la más sana ni la más adecuada. Entonces yo sentía y miraba a mi hijo que a lo mejor su sistema inmunológico no estaba preparado para una vacuna, como la del COVID. Entonces ese era mi mayor miedo. Pero la doctora Julia me habló tan transparentemente sobre la vacuna que comprendí que era mejor que yo tenía que vacunar a mi hijo porque el sistema inmunológico podía afectarle mucho más si él se infectaba con el virus, a que él recibiera la vacuna y pudiera pasar algo. Entonces ya ahí comprendí y accedí a vacunar a mi hijo y ahí ya quedé convencida y ahora estoy feliz porque él no tuvo ninguna reacción aparte de lo normal que tiene una vacuna. Y también él va a poder regresar a la escuela muy pronto, porque siento que también a los chicos los ha afectado mucho el encierro. Yo creo que más de un año estar en casa sin poder salir, porque mi miedo también era que mi hijo saliera a la calle y se pudiera contagiar. Entonces yo tomé la opción de que él no saliera a calle. Entonces pienso que también puede afectarle un poco psicológicamente tanto encierro en casa.
Sí. So my main concern about my son was his immune system, because I know that our kids are not eating healthy. And so I was wondering whether his immune system would even be able to cope with the vaccine or be able to react to it. And so we had a conversation at La Colaborativa with the other health promoters and with Dr. Julia, myself, about vaccines and how young people respond to them. And so I decided to have him vaccinated. And one big aspect of that was also that I was always worried that whenever he goes out into the street, he could get infected, and that I may not be able to prevent that from happening, especially since for the young people, it's been very hard not to be able to go out, and it's been a big challenge for their emotional well-being that they have been closed in like that. So I got him the vaccine soon after that.
That's amazing. You remembered all of that. Thank you. Vanessa, anything else that you would want to add to that?
Solo decir que los padres tomen las precauciones debidas, pueden hablar con sus hijos y pueden aconsejarlos que sí tomen la vacuna, porque es importante que todos nos vacunemos y podamos ya pronto salir de esta pandemia y ya poder estar todos sanitos y poder disfrutar de todo lo que nos rodea. Es todo. Muchísimas gracias.
So yes, I just want to say to the other parents that it is important for our children to be vaccinated for their own health, and also so that we can come out of this pandemic and that our lives overall can get better. And thank you.
Thank you, Vanessa. That was wonderful. We really appreciate your offering your perspective here. So I am not seeing any questions. I don't know if that's a technical issue or a failure of people who submit questions, but I am here to receive them. But meanwhile, I will go to some of the ones we got ahead of time. And I guess a key one, and maybe Dr. Jacques can tackle this one. We're hearing a lot about these variants and how dangerous they are. So can you tell us what variants are out there, and does the vaccine protect against them? And are you really confident about that?
Yeah, it's a great question. And there are two main variants that are out there right now. They have more technical names like B117, but we call that the alpha variant. That's the one that probably about 70–80% of infections right now across the country. And then there's a new one called the Delta variant, B16172. You don't have to remember that, just remember the Delta variant. That's about 20% of all infections. But the Delta variant will become the dominant variant by August, if not earlier. So why does any of this matter? It matters for two reasons. The Delta variant is much more contagious than any variant we have seen so far. And there is a little bit of evidence that even for people who've been previously infected, it may pose a bit of more of a risk in terms of reinfections. And the very, very good news, and I have to say I am surprised at this, but I'm happily surprised. All of our vaccines, particularly the Moderna and the Pfizer vaccines, are doing very well against all of these variants. That doesn't mean they always will, meaning there may be some variant down the road that maybe will push our vaccines effectiveness down. But right now, even against this very difficult Delta variant, the Pfizer vaccine is almost 90% effective. So I feel very confident that our vaccines are in very, very good shape. And it's a very dangerous time right now to be unvaccinated. And it is very critical that people get vaccinated. And it's actually really critical that people get both shots of the Pfizer and Moderna vaccines, because one shot is not enough protection.
What about other variants that may come along? Do you worry about a variant that actually wouldn't work, where the vaccine wouldn't work against it?
It's certainly possible. It's theoretically possible. I guess I feel like that our vaccines, these mRNA vaccines, there are a couple of other vaccines out there, they seem to be so incredibly good and provide such a broad degree of protection that I don't think we are going to have a variant that will completely defeat our vaccines. I do worry about a variant. We will have more variants. First of all, we should be very clear about that. Second is I do worry that our vaccines may be a little less effective. And the best way to prevent this is to get everybody vaccinated. If we can get everybody in the US vaccinated, if we can get the world vaccinated, we can move on from this pandemic. This pandemic can be in the rearview mirror and we can get back to our lives. But that only happens if a large majority of both Americans and the world get vaccinated.
Great, thank you. We have a question from the live audience, and maybe Dr. Kohler can tackle this one. What's your opinion about unvaccinated kids in summer camps right now? Should they be masked while indoors?
Thank you for that question. My opinion is that unvaccinated children and adults should be masked indoors. There is a big difference between indoors and outdoors that maybe has not been highlighted enough in our country, because indoors we have a potential for a buildup of virus, which is almost like a cloud called an aerosol, and that can infect others in the room who may be, more than 6 feet away. So I do strongly feel that the masks have a role. We should be thinking very hard about the aerosols, and anyone who is not vaccinated or for example, who may not be certain of the full effect of their vaccine because they might be immunocompromised. They might be taking medication to intentionally suppress their immune system. The masks provide good protection. In fact, where I am from in Germany, people get free FFP2 or the so-called KN95 masks, those white ones. I should show you one a little later, to ride the public transportation if they can't afford buying them, because everybody has to wear that. So yes, we should take indoors exposures very seriously.
Right. So, Dr. Harris, there are two kind of opposite situations that can occur. One where the child is afraid to take the vaccine, and one where the child wants it and the parent, and there was a story in the New York Times about this, I think yesterday. The child wants it, or usually these are, teenagers, and the parents refusing. What's your advice on dealing with both those situations?
In the situation where the child is afraid to take the vaccine, I think, like with adults, providing them with age-appropriate information about the usefulness of a vaccine, and then also just really exploring with them what the nature of their fear is. Sometimes their fear is related to the vaccine itself. Sometimes their fear is related to the method of getting the vaccine, as I mentioned earlier with regard to needles. And other times their worry is something just more ambiguous that we wouldn't know about. And sometimes they're afraid that taking the vaccine will give them COVID. And other kinds of fears. So I think part of what a mental health professional can do, and often your primary care pediatrician can do, is to help you kind of talk with them about what the nature of their fears are. Once we really get down to the nature of the fear, then we can either provide information, or in the case that there is, for example, perhaps a needle phobia, there are some really basic behavioral skills and behavioral techniques we can use to gradually expose them to the idea of it, help them really become used to that situation in terms of the method, and then become comfortable with that. I actually spent part of April and May doing so with the teenager who was then able to get vaccinated in May and then to get her second dose in June. In the other situation that you mentioned, where the child, or as you said, often an early teen or teen, is really motivated to get vaccinated, but their parent has concerns for various reasons, then I think, you want to, certainly sometimes it's a matter of providing that teenager, let's say it's in a school, there may be pamphlets or things like that that they can share with parents, because often when a parent has hesitation, it's really a matter of, it could be a couple of things. One, it could be that the parent is aware of health issues that really do make it so that there should be some hesitation. And if that is the case, then it's a matter of the parent and their primary care doctor explaining the reason for holding off, if that is the case. Other times it's a matter of providing additional education to parents, or as I mentioned, there are some communities where there is some hesitation and lack of trust with regard to information. And then what we want to do is address those issues of trust with the medical community so that then the information can be taken at face value.
That's great. Well, we have a question from the audience that I'd like you to address, Dr. Harris. How do I talk to my child under 12 about wearing a mask when others aren't? So this is a child who can't get vaccinated, doesn't want to wear a mask. What do you advise?
I have had that experience for the past 10 days. I have the pleasure of having my 6-year-old nephew with me. I live in a house of two children my two children who are 17 and up. And so our whole household has been vaccinated, but he has not. And so he has been asking lots of questions about why he has to continue to wear a mask. And we've explained about how vaccinations are like medicines that help protect us from being sick. And we've been able to take that and describe to him that doctors are still working to make a medicine that will help protect him from getting ill with COVID. And until that happens, it's important to wear a mask. And children over this past year have had the experience of watching their parents wear masks as well. So part of the confusion is about why they still have to and why adults don't. And they just need information, again, just explained in an age-appropriate way. And they understand medicines. Most children have had a cold or maybe even have had a sore throat or something where they've needed an antibiotic. And you're just explaining to them that doctors are still working to create the medicine that will be able to keep them from being sick.
Great, thank you. We have another question from the live audience. Maybe Dr. Kohler can take this one. Have you seen an increase in cases in children since the return to in-person instruction?
I personally have not, but to be honest, I don't think that I would be able to tell apart children who are coming because they probably were exposed in school from children who were exposed elsewhere. I would say to that the following. If we are meticulous about masks, about ventilation, again, that's coming back to the aerosol, to that cloud of virus that can build up around an infected person and can flow through an enclosed space. And if we are meticulous about keeping small groups together, not having children or teachers mix in big groups, and so forth, we can keep transmissions in school down. Now, we do see a big discrepancy between schools that are well equipped and have been able not only to optimize their ventilation, but also, for example, have testing early on right away, and schools that have been crowded at baseline, whose air handling system was bad before the pandemic, and so unsurprisingly, we have to fear for more transmission in those schools, and that is why we really have to focus on equipping the schools, on providing all the resources in each community, including schools like in Chelsea, that children can be safe in school, because that is not a given in our state.
Dr. Jha, do you have anything to add to that? Or could you talk just in general and what's known about the safety of being in person in school?
Absolutely, I'm happy to. So as you might imagine, this has been a very contentious area with a lot of both good evidence, but also a lot of, I think, rhetoric and a lot of just sort of overstatements on all sides. I think what Dr. Kohler said is exactly right. And let me lay out the evidence as we have it. It's very clear that if you put in basic safeguards, what do I mean? Masking, reasonable ventilation. You don't need fancy systems. Schools should not be investing in fancy systems. We're often talking about opening windows, having basic HEPA filters that you can get on Amazon for relatively cheap prices, improving the ventilation of the building, keeping doors open. If we do those kinds of things, it's very possible. In fact, it's quite easy to get kids back in school safely, in a way that's safe for the kids and it's safe for the adults. And of course, now adults have all been vaccinated, and so that's less of an issue. If you don't do any of those things, if you bring kids back unmasked in poorly ventilated rooms, guess what? You do tend to see transmission. This should not be a surprise. We know how to control this virus. And if schools implement these policies, and you don't have to be wealthy and you don't have to be an elite private school, there are lots of public schools across the country that have done it. If we do those things, it's completely doable to get kids back in school safely. It's really, really important that we get kids back in school safely, and it's very doable.
Dr. Jacques, there's another question that just came up about changes to mask recommendations. This person, I'm not sure what they're referring to. Perhaps the World Health Organization said that even fully vaccinated people should continue wearing masks, but the CDC didn't say that, right? So what do you make of all of that? What should people take away from that?
Yeah, this is very confusing, and I'm sorry that people are getting such mixed messages. Over the last 24 hours, WHO came out, actually more than 24 hours ago, and said fully vaccinated people should continue to wear masks indoors. CDC asked about it today, said that they're sticking by their policy. Let me explain why you see a divergence, why you see WHO and CDC. Both sides are right, but that doesn't make quite sense, so let me explain it. WHO is looking at the whole world. And in a world where most people are unvaccinated, where infection numbers are very, very high, if you're a fully vaccinated person, you walk into a room of all unvaccinated people in a community where infection numbers are very high, probably better to wear a mask because you can still have breakthrough infections. If you're a vaccinated person in a community that's highly vaccinated and infection numbers are very low, you largely don't need to be wearing a mask. So it's important what your vaccine status is. Certainly you being vaccinated makes a huge difference. But if you're in a community with lots of people, other people vaccinated as well, my general feeling is, so for instance, Massachusetts, we have very high levels of vaccination. When I spend time indoors with other vaccinated people, I do not wear a mask. However, if I walk into a place where I think there are a lot of unvaccinated people, which thankfully doesn't happen here in Massachusetts, but if I was down in Mississippi or Texas and walked into a crowded room, I would probably put on a mask because around a lot of unvaccinated, poorly ventilated, unvaccinated places, there is a risk of breakthrough infections. That's the confusion. WHO is thinking about this for the world. CDC is thinking about this much more narrowly for vaccinated communities in America.
Yeah, and when we say the vaccine, Dr. Kohler, did you want to add something to that?
Yes, I would like to just say that in highly vaccinated communities in Massachusetts, people protect each other by the vaccine that they have received themselves. However, we also have to be aware that the vaccination rates in community in Massachusetts are very, very widely divergent. And later on, I can actually show a graph about that Boston Indicators compiled. And so I would say it is very easy to err on the side of caution if one is sure, or if I am sure that where I am, the vast majority of people are vaccinated and they have the so-called community immunity, which I like better than herd because I don't want to be a cow. So that is a different situation. But if I am in a place where I know a lot of people have not had the chance to get the vaccine, I think it is easy enough to just put on a mask when I walk into a grocery store. So I would say the masks are wonderful tools. They are cheap. They are reusable if we put them in a paper bag for 3 days. I have masks that I've used for 6 months, and I give away the other ones that I get. So they are a wonderful tool, and we should not discard and discount them, or because they can actually help bring the infection rates down to the levels that we want to see.
Great, thank you. I want to, Dr. Jha has to leave at 7, so I want to take maximum advantage of the last few minutes with him. And I wonder if you could take the next question. What is the percentage of the population that needs to be vaccinated to slow the variant?
Yeah, this is a very good question. And actually, I posted a social media thread on this yesterday, and I'm going to try to put out a bit more detailed analysis later tonight or tomorrow morning. But if you think about the Delta variant, that's the one that is quickly becoming the dominant variant in America and is going to pose a real challenge to us. I believe that you have to have at least 60% vaccination. That's assuming that a lot of the unvaccinated people are people who've been previously infected and have a good amount of immunity. If that turns out not to be true on the Delta variant, and we just don't know, then you probably need something closer to 80%. The good news is Massachusetts as a Commonwealth is already at 60% of the population being vaccinated. But as Dr. Kohler said, it varies a lot from community to community. Some analysis that I posted showed, for instance, Newton, where I live, more than 99% of people over 30, about 75, 80% of the entire population is fully vaccinated. But if you go out just to Springfield, you see numbers that are dramatically lower. And Springfield, of course, being quite a major city in Massachusetts. So the point on this is it varies a lot from community to community, but overall, for the entire population, you need at least 60% fully vaccinated. And right now, there are 4 states, Vermont, Massachusetts, Connecticut, and Maine, with Rhode Island right at the edge that are there. But many experts think we may need more vaccinations than that.
Okay, great. Thank you. And since you have to run, I wanted to just kind of, before you go, if you could just offer, do you have any final thoughts that you'd like to offer about everything we've talked about?
Absolutely. You know, this issue of kids in this pandemic has been very contentious. And I think really, unfortunately so. We can't use our children as political footballs. Children need protection. As a dad of 3 kids, my 3 kids are 16 or almost 16, 14 and 9. You know, my job as a dad is to protect them and to take care of them. And when there's a major health risk like a pandemic, my job is to ask, what can I do to keep them safe so we can get through this time? And there's a lot of, back and forth, but here's how I have thought about it. And more important than my advice is my action. So my almost 16-year-old and 14-year-old have both been fully vaccinated. My 9-year-old, of course, has not, because he's not eligible to be fully vaccinated or to be vaccinated at all. But I expect that when the data comes out on 5 to 11-year-olds, my expectation is that the data will show that it's safe and effective, and he will get vaccinated. Because kids need protection. Think about it this way. This virus will be around for a long time. And so everybody will end up getting immunity from this virus. You can either get the immunity through the vaccine or you can get it through the infection. It's very clear to me which is safer. Let me make one last point. A lot of people raise questions about, is this still experimental? Do we know enough about these vaccines? What about the fact that it's still emergency use authorization, not fully licensed? And I'll say the following, which is we have more data on the safety and effectiveness of these vaccines than almost any vaccine out there. Now, I mean, some vaccines have been around for a very, very long time and we have more long-term data. But the other part is that most vaccines, when they cause problems, tend to do so in the first 8 weeks after administration. We have given hundreds of millions of people these vaccines and have tracked them for 6, 9, 12 months. I am supremely confident about the safety of these vaccines. They're not 100%, nothing is. But these vaccines are safe enough that my entire family that's eligible has gotten vaccinated. And I have urged other people to do it because it's good for them, it's good for their families, it's good for the community.
Great. Thank you very much, Dr. Jobs. It's great having you with us. Bye.
Bye-bye.
So Dr. Kohler, you said you had a chart. Actually would kind of like to see that. I wonder if there are places in Massachusetts where people really need to be careful and be masking up.
Absolutely. Let me look for that and share the screen. I got it ready because let's see. So to just, I opened too many other things. Sorry about that. Let me look for that again. So to just, start talking about what this chart shows. So it is data compiled by Boston Indicators, who, which is the research arm of the Boston Foundation, and they looked at vaccination rates versus infection rates across communities in Massachusetts. And what they found was that, now these data are from April, but I am quite convinced that the relative trend, even if the absolute numbers have changed, but the relative relationships are still the same. And what they show is that the more COVID a community has had, and I don't know if you can see it now.
Yeah.
Okay, so this is the, so Massachusetts has not yet successful. Now this was in April, but what you see here is the vaccination rate per community. And the communities are color coded as to their so-called social vulnerability index. In other words, gray are wealthy and well equipped communities. Green are moderately wealthy. Yellow are low resource, and red are low income communities. And what you see, although the absolute numbers I don't think are true anymore, in fact, I know they're not true, but the relationship is still true, which is that the lower a community's COVID rate has been, the higher their vaccination rate. As Dr. Jha just said, Newton has a 99% vaccination rate. That is incredible, and I believe it, because these are my colleagues and they have all gotten vaccinated. And you see also that over here in the group of communities that are well vaccinated and low COVID rates, these are the wealthier communities, and the communities that are the low vaccination, below 30% back there in April, Springfield, as Dr. Jha mentioned, New Bedford, these are the communities that have had a higher COVID rate and have lower vaccination rates, which is exactly the opposite, of course, of what you want to have. If a community has lots of COVID, you want their vaccination rates to be high. Now, I just want to point out one outlier that has the highest COVID rate in Massachusetts, and that is Chelsea. But relative to the other communities in this social vulnerability index, they have a higher vaccination rate back there in April. And I would claim that relates to the work of La Colaborativa, who starting in the fall already began talking about vaccines, who worked hard to educate the community on how to prevent COVID, including with masks and distancing. Ventilation is a hard concept, but it's a very, very important concept, and La Colaborativa has been thinking about it. But as soon as the vaccines started to become available, they initiated conversations with Chelsea residents about vaccines long before most Chelsea residents became eligible. And in addition to that, these conversations were combined with care. So care for food, care for housing, care for whatever issues the residents have there in Chelsea. We can talk more about that if you want, but what I would say is what we need in Massachusetts to answer the doubts of people who wonder, well, I was not cared for throughout this pandemic. Now people are coming and are saying I should get vaccinated. What are they really talking about? And that speaks to some of Dr. Lewis's points.
So could you stop sharing your screen? Because Dr. Harris has got something to say.
Yes,
And
sorry. Yes.
I'm very interested in hearing your thoughts about the role of community in persuading people.
Sure. I really appreciate your sharing that map. I think it really shows one of the other things that occurred during this pandemic was just really an aspect of disparities that occurred, right? For many of those families and communities that had financial resources, many of those have jobs that could convert to working remotely. Whereas those families whose parents were living in less resourced communities often had jobs where they had to leave homes and throughout the pandemic and were deemed our essential workers, right? Those were the people in our grocery stores who provided us with food throughout the pandemic. Those were the people at our gas stations. Those were the people who did not have the privilege to really quarantine in that way. So I think it's really important when we go out to do outreach, and as you said, really talk about our care for those communities. I think it's really, really important to talk, not to provide the information about the vaccines, but also to talk about the differences in privilege that we experienced throughout this pandemic that made some families, frankly, more at risk for illness and others more protected.
So, Dr. Harris, I have a related question to that. It was very interesting what Dr. Kohler was saying about the role of the La Collaborative, you know what it is, like former Chelsea Collaborative in affecting, vaccination rates throughout the community. And, we've been talking a lot about individual decisions, but can you talk about how does a community group have that much of an influence on people?
Was that question for me?
Yes.
Okay. Yes. Well, I think first of all is having relationship, for the medical community to have an ongoing relationship with the community in which it serves in and out of a pandemic. So this kind of outreach of going door to door to provide, health information is something that we might just think about in terms of health in general, or to really, for example, at the Cambridge Health Alliance, one of the things that we've really been thinking about and encouraging our primary care physicians to do is to really screen for social determinants of health, right? There are aspects of just food, health and, heat security, those kinds of things that families are going through all the time. And if we express an interest and provide resources for those kinds of things from day one, when it comes time for something that is affecting people worldwide, then we already have the legitimacy of a relationship. And I think that door-to-door outreach, I suspect, really went a long way to show the community that it wasn't, just sort of a fly-by-night, this is what the CDC says, but truly an interest in the health and well-being of folks inside and beyond the pandemic. So that sounds like a wonderful model. And I think it also gives you an opportunity when you speak to people one-on-one and multiple people, you hear a thread of what their concerns are. And I think that really helps us from a public health perspective, as we often find in psychology and psychiatry, there are the experiments you can do in the lab. And then there are the things that you learn when you have community-based research. And sometimes those things overlap, but oftentimes they don't. So that door-to-door community outreach really helps you figure out what are some of the things we might not have thought of that may be really important in helping increasing the health and answering questions that we may not have thought to be there, and in this case about vaccines.
That's great. Dr. Kohler, Dr. Jap sort of addressed this, but we still have a question up here about the difference between emergency approval and full approval, and people who just want to wait till it gets the full approval. Does that make any sense to you, or what is the difference?
Well, emergency approval was given because of obviously the emergent nature of this deadly pandemic, where there were times in the United States where 3,000 people were dying a day, which I honestly cannot even wrap my head around. And the fact that clinical trials showed that the vaccines were as effective as they were and had relatively few to none long-term or understandable, knowable long-term side effects. So they were approved to be administered on an emergent basis. Now, the FDA, the Federal Drug Administration, has a very prescribed process for safety and efficacy of a new medication that has to be run through step by step in order to give full licensure to a new medication. In my personal opinion, I personally would not base my decision on that. I feel that we need to think about the danger of the virus and our own risk. Let's say I am immunocompromised, living in a low vaccination area, or even I'm just an average person or someone with asthma living in a low vaccination area. I am at very high risk for this virus, and I'm going to get vaccinated regardless what the FDA has checked in its boxes. Now, Dr. Jha said there is a lot of information about the virus, about the vaccine. So I personally would not base my decision on that. The side effects of myocarditis in young men, especially young boys and men, and especially after the second dose, we need to take note of them. Parents need to know that chest pain can be a manifestation of that. I would base my decision in the fact that myocarditis from this infection, inflammation of the heart from the virus, is far more dangerous than this only known side effect, longer term side effect of these mRNA vaccines. So it's a very personal decision. Everyone has to make that decision for themselves. But given the disparities that Dr. Lewis Harris highlighted, I feel there was not enough care for frontline communities in Massachusetts. And now residents of these communities have a tool to protect themselves, a very potent, effective tool. So my advice has been to residents of these communities, and I talk with the janitors and the security staff and so on in my building as well. I talk with everybody about it. The shocking fact is that Massachusetts has had a 3-fold higher death rate of Latino and Black residents from COVID than of white residents. That is shocking. Now there's a tool where everyone can protect themselves, and white people have been getting it at higher rates. What do I think about that? Do I not want to take advantage of that tool? That is what I would say, and especially with these shocking disparities, I would say, if you can access the vaccine, take it.
Can you also address this issue that keeps coming up about infertility? I don't know where it came from, but there's a conspiracy theory really that the vaccine can affect reproductive health. What can you tell us about that?
Oh, absolutely. There are many questions that come up in both in the door knocking, as Dr. Lewis Harris highlighted, and also in online information sessions, and infertility is an important one. It is definitely not true that this vaccine or any vaccine causes infertility. Now, there are contraceptives that are also injected under the skin, and that, you go to the doctor and you say, I want a contraceptive. I don't want to have a baby. Can you please give me one of these gosh, I'm blanking on little cartridges that slowly release the contraceptive hormone that otherwise one would have to take by a pill every day. So perhaps because of the injection, that connection was made, but it is not true that the vaccine causes infertility. And in fact, we often have the question about pregnant mothers or about mothers who are breastfeeding. Is it a good idea for them to get the vaccine? And the answer is yes, because for two reasons. Number one, pregnant mothers have a higher risk of severe illness from the infection with this virus. And number two, both vaccination during pregnancy and also vaccination after birth and during breastfeeding will enable the mother to give her child some immunity through her own antibodies. Before birth, it's antibodies that are given to the baby through the placenta, through the mother's and then the baby's blood, and they will protect the baby for some months. And a breastfeeding mother will pass those antibodies into her breast milk. So she gives the baby a wonderful present every time she breastfeeds. So these are important questions that come up legitimately. Similarly, people are afraid of catching COVID from the vaccine, and there's reasons for that. For example, especially after the second dose, people feel feverish, nauseous, etc., as if they had a virus. And also, so it feels maybe like you became infected, although that's simply the good reaction of your immune system that is showing it's responding the way we want. And also there are vaccines that contain live viruses, just weakened live viruses, like the measles vaccine, the chickenpox vaccine. So these are, very legitimate, good questions. And because they are important questions that many people have, that is why we need these conversations. And that is why we need to express that we care about people by offering information and conversations and dialogue in an ongoing way.
Can you address one of the questions that we got ahead of time had to do with the issue of long-term effects? I mean, this virus hasn't even been in existence for that long, and then we have a new vaccine. How does anyone know what'll happen over the years? Is there any risk at all that there will be some kind of side effect that would crop up years later?
I would like to respond to that with two parts of an answer. Firstly, I personally am very scared of the long-term effects of this virus. We already know that people who had the actual COVID pneumonia can have scars in their lungs. People have had strokes. Kidney damage has occurred. People have had clots. So this virus, some people's hearing has become impaired and has not returned. So we know this virus affects more organs than just the lung, and especially the brain. And there's also the so-called long COVID, which we really don't understand, which consists of tiredness, inability to focus, inability to remember, dizziness when we stand up. And that has affected between 10 and 20% of people who had the infection, not even severely, but maybe just a mild case. That to me is very scary. The vaccine, as Dr. Jha highlighted, side effects of vaccines tend to occur within 8 weeks of the vaccine. It seems unlikely to me, although I don't know this. We're human beings and we have to be humble and realistic that there are things we do not know. So to the best of our understanding, it seems very unlikely that side effects will occur after those 8 weeks. Now, this myocarditis in young boys, young men, a very rare side effect and much milder than the one that has happened due to the infection, to the virus, to the disease, is a true side effect. It's not just, I'm feeling hot and dizzy after my second dose, and it's not just my arm got really red and hurts. This is a, side effect. However, do I think that there will be long-term issues from the vaccine? My prediction, with all humility, is no, because we're injecting an instruction for a piece of virus, an mRNA. Our own cells make that little piece of virus the spike protein. They induce an immune response against that, so that when an actual virus with its spike protein tries to enter our cells, to use that spike protein to unlock our cells and get into them, our immune system will be ready to grab onto it and prevent that from happening. That is what the vaccine consists of, and that protein and that mRNA is gone in a short time. The protein actually is also gone within, I'm guessing, weeks. So no, again, with all humility, I strongly doubt that there will be other side effects years later that have not happened now.
Great. We have another question from the live audience that probably either one of you could tackle. Are children experiencing the same symptoms as adults when they get the vaccine?
I'm just going to say yes.
Yes, it's exactly the same. All right. So we have 8 minutes left, and no pending questions, but I would like to give you each a chance to kind of sum up your thoughts. Maybe Dr. Harris, if you could go first, based on our conversation, based on everything you've heard in the community, what message would you like to deliver tonight?
Well, yes, again, I really want to thank the organizers of this really important panel and the audience for your really thoughtful questions, because I think it really helped us to provide some really important information. To parents, here this evening, I'd really like to say to continue attending things like this, to get as much information as possible and to ask your questions. Please know that your questions are really valued. If you are hesitant because you have questions, please don't hesitate to reach out to your primary care physician and ask questions. They really are eager to want to answer them, to help reassure you about getting a vaccination for yourself, and also to help you have information so you can have an informed decision about decisions you want to make for your children. And as Dr. Jha mentioned, that we will have upcoming information about the vaccine for younger children, and know that one of the things about science is that we don't recommend that humans do things that we aren't clear won't hurt them. So know that when the CDC or other government organizations say, okay, now we think it is safe to do this, that there's a lot of thought and care that has gone behind that. And I also just really want to validate the concerns that some communities, including the community that I come from, an African American community, where there is a hesitation that's related to a history of misuse of communities for medicine. And even with that, it's all the more reason why I say seek information, know that your questions are valid, and push. If you ask a question and you're still not clear, or you feel like the question wasn't fully answered, ask again in that space or ask in a different space, because the information is there, including tonight. If there was anything that we didn't adequately answer, I want to encourage you to reach out to our organizers and pose your question. And I'm sure myself and other panelists agree that we'd be happy to try to get a more fuller answer for anything that you've asked.
Great, thank you so much. Vanessa, did you have any final comments you wanted to make? If you're still there, Vanessa? I guess not. Okay, oh, Vanessa, here she is. Any parting thoughts?
No, solamente que muchísimas gracias por la invitación a este panel y nada, hacer el llamado nuevamente a los padres que puedan vacunar a todos los niños, que ya no estén metidos solamente en redes sociales, que eso no es una buena información para ellos, sino que buscar asesoría con personas que sí saben sobre la vacuna. Y nada, vacunarse, recuerden que la vacuna salva vidas. Y eso, muchísimas gracias por todo.
Dr. Kohler.
So yes, thank you so much for having me and for having this excellent panel. I only want to say to the parents, please get the vaccine. This vaccine saves lives. Talk to your doctor. Don't pay attention to social media where there are a lot of untruths, but talk to the people who know, whom you can trust, and who have your child's and your own interests in mind. And thank you again for having me.
Thank you, Vanessa. And Dr. Kohler, any parting thoughts for our last 3 minutes?
Yes, thank you so much. I think that we will be thinking about this pandemic for a long, long time. At least I hope so. There are so many lessons we have to learn. I feel that we witnessed a lot of failures of caring, and that is, which in the end resulted in death. And I feel that, we now have vaccines that can help protect us. They are not the end all and be all. Again, we need to be humble. We do not know what is coming. The vaccines are a fantastic tool, far better than anyone dared to hope. But we have to continue to be careful. I do feel like, for example, in schools, we have to invest in the schools. The ventilation is very different in Chelsea from Newton. That is why the federal government is giving money to each state so that we can put our money where hopefully our heart is. And lastly, I want to say Dr. Lewis and her colleagues are so hugely important. I think maybe, you know, for children, it has been so hard because kids need to run around, they need to play with each other, they need to socialize. We saw a huge mental health actually crisis, I want to say, in the hospital. And I think one of the ways to really also reassure kids is by caring for their families and for their communities, for their teachers. We need to care for the children's teachers. And we need to gradually find our way back to common ground where caring for each other is the way that we understand we're going to be caring for our own family. Caring for others' families, we're going to be caring for our own family and for ourselves. That would be my fundamental message. And I want to also congratulate the city of Somerville for everything where Somerville was a leader in our state, including with respect to the schools. And I hope that as we process what has happened over the past 15, 16, 17 months, we learn from each other what worked and what didn't and what we need to do going forward.
Thank you so much. And that was a beautiful thought, that caring for others is a way to care for ourselves and our families. Well, thank you. This has been a great panel. I learned a lot, and you were all wonderful speakers. And thanks to the audience that came in with so many great questions. And I think we're done. So thanks, everyone.